Every year, millions of patients facing a medical crisis step into these machines. For many of them, the images produced in the next few minutes will be the exact difference between life and death. But the technology that makes this life-saving visibility possible comes with an invisible catch. The exact same energy used to find a deadly disease inside your body also carries a well-documented risk of causing one. To understand how both things can be true, we have to look at what a CT scan actually is. By firing multiple X-ray beams from different angles, a computer slices your body into cross-sectional layers, giving doctors a highly detailed 3D map of your internal organs. If you are experiencing a stroke, severe internal bleeding, or kidney stones, your care team cannot wait for exploratory surgery. They need instantaneous, perfect visibility to act. So doctors face a strict calculation. They have to weigh the undeniable, immediate need for that internal map against a delayed, microscopic biological cost. To see that cost, we have to leave the emergency room behind and travel deep inside your cells. CT scans rely on ionizing radiation. This means the X-ray photons passing through your tissue carry so much energy that they can actually alter the physical structure of your atoms. When one of those highly energized photons strikes an atom in your body, it can knock an electron completely out of its orbit. This instantly destabilizes the local atomic structure. That single missing electron and the microscopic instability it creates is the physical starting point for all radiation risk. If displaced atomic energy collides with DNA, it can break the ladder holding your genetic code. It may snap a single strand or create a severe double-strand break, shearing the helix. Fortunately, specialized repair proteins instantly swarm the site, reconnecting the severed ends. For the vast majority of the DNA fractures caused by a CT scan, these natural defense systems rebuild the code perfectly within minutes. However, in extremely rare cases, the cell makes a mistake during the repair process. The helix is patched back together incorrectly, leaving a permanent structural error known as a mutation. One mutation alone does not equal cancer. For a tumor to form, that single damaged cell must survive, replicate, and accumulate dozens of subsequent errors over the course of 10, 20, or 30 years. So, while the radiation from a scan absolutely has the physical capacity to initiate this decades-long biological chain reaction, you are looking at a microscopic probability, not a guarantee. Which brings us back out to the hospital room. Doctors have to compare the abstract, long-term probability of a cell mutating against the tangible, immediate reality of a patient in crisis. When the statistical increase in lifetime cancer risk from a medically necessary scan is weighed against the protective shield of an accurate diagnosis, the math is remarkably clear. Finding a hidden tumor early means a surgeon can remove it today. The immediate survival benefit of knowing exactly what is happening inside your body vastly outweighs the delayed mathematical risk of the radiation. Even with those odds heavily in the patient's favor, modern medicine doesn't leave safety to chance. Hospitals worldwide operate on the ALARA principle, meaning they keep radiation doses as low as reasonably achievable while still getting a clear image. This protocol is heavily enforced for vulnerable populations. If the patient is a child or pregnant, radiologists apply intense scrutiny, adjusting the equipment to emit the absolute minimum effective dose. As this breakdown shows, the long-term risk of radiation is minimal, while the immediate diagnostic benefit is high. Looking at the evidence through this lens replaces medical anxiety with informed confidence. Knowledge reduces fear. The physical risks of ionizing radiation are real, but you should never avoid a medically necessary scan because you are afraid of the machine. When your life is on the line, clarity is your best defense.